Hi everyone, welcome back to Radiology Short Cases. Today we have an 18-year-old female with history of chronic headache from past few years. These are the NCCT scan of the brain at the level of lateral ventricles. So what we see here in the axial sections, there is a fat density lesion in the region of the corpus callosum. It has value of approximately minus 60 to 70 Hounsfield unit, and its density, if we compare with the lateral ventricles, it's less than that of the CSF. Similarly, on the sagittal reformatted images, this lesion is curvilinear and it is typical in location at the level of body and splenium of the corpus callosum with mild hypoplasia as shown on the this image. So what is the diagnosis? Diagnosis is pericallosal lipoma of curvilinear variety. Here in this case, there is no differential diagnosis because it is a spotter case for the postgraduate examination. Briefly about pericallosal lipomas, they are approximately 45 to 50% in incidence, and of two varieties. One is tubulonodular type, second is curvilinear variety. What are the other locations where we typically see these lesions? These are quadrigeminal cistern lipoma, suprasellar cistern lipoma, cebulopontine angle lipoma, Sylvian fissure, and choroid plexus. CT findings and MRI findings of these lesions should be kept in mind to confirm the diagnosis. So on CT, we will see fat attenuation density with very well circumscribed margins, and it will be having a typical location. And remember, there is no perilesional edema, no calcifications in this lesion most of the time, but sometimes you can see some peripheral calcifications. On MRI, it is a T1 and T2 weighted hyperintense signal because it is a fat. Secondly, if you give post contrast images and if you see it on the T1 weighted images, there will be no enhancement. On T1 fat sat sequence, it will be showing suppression of the signal. Because of that, you will see low signal of the lesion. And on susceptibility weighted images, there will be blooming seen within the lesion due to the chemical shift artifact. With this, I will end. Thank you.